let's talk about meniscus tears in the knee. So what the meniscus is a shock absorbing disc that sits here between the femur bone or the thigh bone and the tibia, and that's what the knee is. And so we have these little discs in here that sit between and act like shock absorbers. And their goal is to protect the cartilage, or the articular cartilage, which is the smooth stuff on the end of the bone. It's kind of like rubber on the tire, that when that wears down, that's what arthritis is. So these menisci are shock absorbing discs that help protect the load that cartilage sees to provide longevity to the knee. They also help provide stability to the knee as well, but it's really common to get tears in these menisci, and there are different patterns and different shapes of tears and different types of tears, and you can imagine you can have little tears that are just kind of like a little fray right here, or you can have a complete tear where it's detached from the back, or you can have what's called a bucket handle tear where it's detached all along the back and then it's even flipped into position and blocking motion. And then there are just little flap tears too that can create a situation where that piece is flipping back like a hangnail and stirring up inflammation. So a lot of different tear patterns. And we also have a medial meniscus and a lateral meniscus. The medial one's on the inside part of the knee and the lateral one's on the outside part of the knee. And there are different situations that we see meniscus tears in. So one of those is an acute meniscus tear. Either you have an injury, or it can even be associated with another ligament injury like an ACL tear or an MCL tear. And those are acute tears, and they're more likely to require an operation as opposed to a chronic degenerative tear. There's a large percentage of individuals walking around with meniscus tears that don't even know it. They've shown that a high percentage of people over the age of 50 have a meniscus tear and have no symptoms related to it at all. So not every meniscus tear needs an operation. And that's a different scenario. That's something that just over time the tissue has not become as good, and it has little frays in it or little undersurface tears that may or may not be painful. Now some of those can become painful, in which case we try to get them calmed down and back to the state before where it was torn and your body didn't know it. And we try to do physical therapy, injections, and activity modification. But if that doesn't work, then we do have an arthroscopic surgery where we can go with a camera and trim up that meniscus and just take out that piece. And I tell people it's kind of like clipping fingernails. It's like kind of like taking away a hangnail. And hopefully that reduces the inflammation associated with that and reduces the pain associated with that. You know, a couple other special scenarios that I mentioned, a bucket handle meniscus tear is where the meniscus is totally detached at the back and then it actually flips over and gets stuck in the notch of the knee and basically acts like a door jamb and blocks motion. And that can be, people will come in with a locked knee in that scenario, and that's important for us to operate sooner rather than later. What we'll do is we'll flip it back where it came from and then try to put stitches in there. If it's a really small piece, or if the tissue's not very good, we'll just pluck that piece out. But we're more likely to try and repair those because they're usually more peripheral where the blood supply is and they have a better healing potential. And it's a lot of times a really big piece of meniscus. The other special circumstance are meniscal root tears. So the meniscal root is where it's attached to the bone in the front and the back. And if you detach that root where that meniscus is attached to the bone, there are some biomechanical studies that show that that's the same as having no meniscus at all in terms of its ability to be a shock absorber. So that can have important consequences, and there are other studies that show that you can sometimes get pretty rapidly progressive arthritis if we were to leave that alone. And so those, even in our individuals over the age of 40, we are still likely to repair that, where we go in and put stitches in it and try to repair it back down to the bone to get it to heal there and restore its ability to be a shock absorber and protect the knee long term. Now sometimes if you have too much arthritis, that's kind of, it's a futile attempt. You already have arthritis and so it may not be able to protect it. But those root tears, we are more aggressive about repairing them as opposed to just going and trimming them out. In our young athletes, we're more likely to try and repair the meniscus as opposed to taking it out. Now, why don't we repair every single meniscus? Well, the meniscus doesn't have the best blood supply in certain parts of it, and sometimes it's all beat up and there's no real good way to put stitches into it. And furthermore, if we try and repair it, we do have to protect it, and so the recovery is a little bit different. And then the downside is if we try and repair it, we put you through a recovery where we have you on crutches and limiting your activities, and then lo and behold, it doesn't heal and it tears again, then we have to go take it out. That's always an unpleasant situation, but the goal with repairing a meniscus is to try and preserve your tissue, to be a shock absorber for the rest of your life. and we base that on certain factors: tear pattern, where the location is in the tear, as well as your specific demands and activities. And so that's something that we'll have a conversation about, but that's just kind of a brief overview on the different types of meniscus tears and some of the different treatments that we have for them. So we look forward to meeting you. We look forward to helping you.